Good evening. Thanks for joining Congresswoman Wasserman Schultz's town hall tonight. She will be joined by two very knowledgeable policy experts who can help you navigate what to expect with this latest possible Trump shutdown, and specifically answer questions around the unfolding healthcare crisis. Just a quick reminder before we begin, please type any questions you have into the comment section of the social media platform that you're watching this event from tonight. And we fortunately have had hundreds of questions already submitted and comments, and we'll try to tackle some of those first. And one last note, while there is a lot to be anxious about in the current political climate, we're focused on discussing healthcare and shutdown issues tonight. But rest assured, the Congresswoman will be holding more town halls, and she'll continue to take more questions, and she always shares what she's working on. So with that, let me hand it off to the Congresswoman to get us started tonight.
Thank you so much, Dave. Good evening, everyone. Thank you so much for joining me. I am so thankful for the opportunity to spend some time with my constituents this evening. House Democrats are in DC ready to work. That's where I am right now, here in my office in the Capitol. I'm working hard for you by fighting to protect your health care and fighting to keep our federal government open. Many of you know that I'm a senior member of the Appropriations Committee. This is the work that I focus on every single day. But sadly, congressional Republicans have long since left town and are threatening to shut down the government unless they can continue to cut our health care and raise prices on working families. We saw exactly that in the big ugly law they just passed. That legislation included the deepest cut ever to Medicaid. The nearly $1 trillion that was slashed from that program will result in 15 million Americans losing health care. Let me be very clear. These are Americans that will lose their health care, not undocumented immigrants, as Republicans continue to lie about. And it was all done to hand massive tax breaks to the wealthiest Americans. That horrific law passed the House in the dead of night. And here we are again, a rushed legislative scramble on a major budget deadline, and it's one that threatens to eviscerate health care coverage for millions more Americans. Republicans must sit down to negotiate with us. They need to negotiate a bipartisan budget that lowers costs and protects Americans' health care. President Trump and congressional Republicans cruelly created an unnecessary health care crisis in America. Prices are climbing, our economy is stalling, and health care is being ripped away from working families and veterans. More than 200,000 people in my district alone will see their health care costs soar if Republicans let Critical Affordable Care Act tax credits expire. For many of them, that cost hike will just be too high, and they simply won't be able to afford any coverage. Between the Medicaid cuts Republicans just enacted and the potential gutting of the Obamacare credits, 82,000 people in my district alone could lose health care coverage. I will not stand by and watch that happen. Like my fellow Democrats, I will not give a blank check to Republicans to force through even more extreme health care cuts. I will not vote to let Republicans jack up prices even higher and make it harder for Americans to be healthy, safe, and financially secure. Democrats will support a bipartisan funding bill that keeps the government open and steers us away from a full-blown healthcare crisis. We're ready to negotiate that now. We're here and they're not. And we'll do that by preventing skyrocketing out-of-pocket premiums for millions of Americans. No matter what they say, we all know the truth. Floridians are hurting. Home insurance and rent costs are through the literal roof. Utility bills and a cart full of groceries cost more and more every month. If you own a business or want to start one, federal help has been gutted. And if erratic Trump tariffs haven't killed your bottom line yet, they've paralyzed your ability to act. And now, whether you earn a paycheck or need to make payroll, your healthcare costs are about to explode. In my district, for example, a family of four who earns $64,000 a year will see their premiums rise by $2,500 annually if we don't act to reenact those tax credits. That's a 182% increase. And when families opt out of coverage because they can't afford it, not only will people receive less medical care, but insurance companies will raise rates on everyone to make up for the lost customers. And healthcare costs will increase to make up for patients who can't pay. That's called cost shifting. Price spike notices are already arriving in mailboxes as we speak. And government funding runs out tomorrow. Yet Republicans refuse to relent and continue to push a partisan spending bill that will cause healthcare costs to soar. At today's White House meeting, Democrats stood firm to keep the government open and lower healthcare costs. This can't wait 7 weeks. We need to stop this healthcare cost crisis now. Because of Republican inaction, premiums, co-pays, deductibles, and prescription drugs will continue to skyrocket. Democrats are very clear on this. We support government funding legislation that cancels the cuts, that lowers our costs, and saves healthcare for the American people. But we will not rubber stamp any Republican partisan spending bill that causes healthcare costs to soar. This conversation is part of that, to make sure you know what's at stake. So I want to accomplish a few things tonight. First, I want to answer your questions, and a lot of you have sent them in already. But we're going to focus on healthcare issues tonight, and we're going to talk a bit about what a shutdown might mean for our community. Hopefully, Republicans will finally sit down and negotiate a spending bill with Democrats that doesn't explode your budget by blowing up healthcare costs. My job tonight is to make sure that you know and understand what's at stake and what could happen if Republicans opt to shut our government down. To help me do that, I invited two expert analysts who know healthcare policy intimately. Before we jump into questions, I want them both to share a few words. Vaishu Jawahar is a deputy director at Protect Our Care, and she brings years of health policy experience to our talk tonight. And Protect Our Care is one of the preeminent national groups fighting for quality, affordable healthcare access. Vaishu, would you say a few words, please?
Yes, happy to. Thank you so much, Congresswoman, for having me here tonight. There's really no more important time to talk about healthcare than right now. American healthcare is unfortunately in a crisis. Since taking power, Donald Trump and congressional Republicans have launched an all-out attack on our healthcare system. From everything the Congresswoman said, you can tell they're hiking premium costs on the middle class, they're slashing Medicaid, they're driving rural hospitals off a cliff, and they've created a disaster for working families and sadly only helped billionaires get richer. Now they want to end health insurance tax credits for working people and put affordable care out of reach for millions, and they're threatening to shut down the government to do it. This summer, Republicans passed the largest cuts to healthcare in the history of our country to fund tax breaks for billionaires. Their bill is stripping 15 million Americans healthcare and hiking costs for millions of working class families, all while giving tax breaks to billionaires and big corporations. And while Republicans extended scores of tax breaks for the wealthy and made them permanent, at the same time, they've refused to do them for the millions of Americans who depend on these tax credits for life-saving care. Families across the country are paying the price of the Trump GOP budget bill, and from California to Maine to Florida, where a maternity ward recently closed in South Florida at Jackson South, hospitals and clinics are closing, and insurance companies are jacking up premiums. Seniors are being priced out of their prescriptions, and Republicans are ripping away tax credits that are helping millions afford coverage. Just to highlight some of the numbers that really show how the GOP bill is going to affect people, I just wanted to point out that low-income seniors will be forced to pay thousands more each year for health care because the Republican bill will raise their premiums and out-of-pocket costs. Seniors and taxpayers will pay more for prescription drugs because the GOP gave Big Pharma a multi-billion-dollar bailout and allowed big drug companies to avoid negotiating prices with Medicare for a wider class of drugs. Premiums are going to skyrocket on average 90% for over 20 million Americans, including rural Americans, small business owners, and middle-class families. And over 5 million people will be forced to take on as much as $22,000 in medical debt. Emergency rooms will be packed with patients who are unable to cover the cost of their care without insurance, and that's going to lead to higher bills and increased premiums for everyone. And healthcare costs will also spike as rural hospitals close because prices will go up at nearby facilities. The national deficit's out of control, and because the bill was so bad in inflating our deficit, it's going to trigger over $500 billion in cuts to Medicare. So seniors are definitely going to be hurt by this. But sadly, the fallout of the GOP war on healthcare doesn't stop there. By confirming RFK Jr. to lead HHS, Republicans have dismantled the CDC, gutted medical research, restricted vaccine access, and spread deadly misinformation. RFK Jr. and Donald Trump together have created a public health catastrophe that will only worsen as they continue to slash Medicaid, hike premiums, and hike drug costs for the American people. And hopefully that provides a broad overview for everything that we're going to talk about tonight. Thank you.
Thank you so much, Vaishu. I appreciate that. Now we're going to hear from Holly Bullard. Holly is in Florida's healthcare trenches every day, and the Florida Policy Institute is who she's with, and it's an independent, nonpartisan nonprofit focused on promoting policies and budgets that make life more affordable for all Floridians. Holly, do you want to say a few words?
Hi, thank you so much, and thank you, Representative, for having me today. And hi, everyone. I'm Holly Bullard with Florida Policy Institute. And I really wanted to drive home what's at stake for Florida and, specifically South Florida, in terms of what's at risk for the enhanced premium tax credits, what are known as the enhanced premium tax credits, but what many people know are just really supports for your healthcare costs for the ACA, for ACA plans that folks participate in. Many people don't realize that Florida actually receives more funding and support from Obamacare than any other state in the nation. I jokingly call it Florida, we could almost call it Florida Care, honestly, for how much it is, how much it impacts us. Sorry, my son is trying to get into the room. Lots of parents out there as well with your kiddos. We have over 4.7 million people right now. So that's 1 in 5 people in Florida on the ACA. It's not only going to get more expensive for those folks, but it's going to get more expensive for everyone when those ACA tax credits, which are on the line right now, if those go away or those enhancements do. In 2021, the enhancements were included in the Biden administration's and Congress's American Rescue Plan Act, so ARPA, and then they were extended in IRA. And Floridians have really flourished. Our healthcare really depends on the ACA and these enhancements to these tax credits. And to just give an example, down in Broward County, if you are a couple who are both 60 years old, so nearing retirement, maybe you have a part-time job that doesn't quite give you, doesn't offer healthcare, and you use the ACA, Obamacare, for your health care, for the last few years, you've been receiving this enhancement for your tax credit. But if the enhancements go away, so if this extra subsidy actually expires and the majority party doesn't extend it actually or agree to that, then a couple in Broward County, their premium's going to go up more than $1,500 a month. That is a mortgage, an extra mortgage that nobody has, right? In terms of our increasing costs in Florida, and so what's going to happen? Those folks are going to drop their care. It's just it's a tremendous problem in our state, and something that we should be really coming to the table about, and not pointing fingers. Our healthcare is really important to our economy, keeping workers together and families healthy. And so it's just something that we need to come together on. One study by Kaiser Family Foundation pointed to almost 1.9 million Floridians expected to lose their healthcare if this doesn't come to pass, if we don't preserve these enhancements and then extend them. And that's almost 1 in 10 people going to lose their insurance. That's going to fill up our emergency departments. It's going to skyrocket the cost for everyone's insurance, actually, because that's how insurance works. The more people get dropped from coverage or lose coverage and drop insurance, the fewer people are in an insurance pool, and the higher cost is for everybody. And in fact, we should all know this, because in Florida, actually, we have a very high cost of insurance. And this is because we have the 4th highest uninsured rate in the nation already, right now as we speak. And it's just about to get even worse. So it's going to spike to be very near the top. I think we would be tied probably with Texas, who we're always in a competition with, it seems. But these are all very scary things for families, both pocketbook issues and healthcare coverage issues, needing to access care for cancer, for long-term care, and all sorts of things that are going to be impacted. And so these credits are just really key and core, especially to South Florida. So that's what I'll say last, is that Broward and Miami-Dade have more people leveraging the ACA and these tax credits that are on the line than anywhere else in the entire nation. South Florida is really the epicenter of what will happen in terms of healthcare impacts and economy impacts if this comes to pass. And so it's really important everyone is engaged and says, no, we do not have to, honestly give tax credits to very, very high wealth individuals. We can actually invest in our health coverage and ensure that everyone has access to care. So with that, I would love to give my time back.
Thanks so much, Holly. I really appreciate that. And we're going to start jumping into some questions. But first, I want to just do a quick reminder. If you have a question, please submit it in the comment section on the social media platform that you're watching this on tonight. And we'll try to get to as many questions as we can tonight. The first question that we're going to take is from Sarah, and she's in Pembroke Pines, and she asks, what are the tax subsidies that will be taken away from marketplace plans, and are they going to be gone completely, and how will this impact Americans? And I think the opening remarks from folks sort of cover that a little bit, but Congresswoman, do you want to take a stab at that first?
Sure, absolutely, and Holly did just cover that, but it is really important that we dive a little more deeply, especially in terms of how exactly it's going to affect people who have these enhanced tax credits, the subsidies that Holly referred to in our district. I mean, as she mentioned, we have the most Obamacare signups of any state in the country in Florida. And in Broward and Miami-Dade County, we have the most signups in the state. So we are, as she said, the epicenter for quality, affordable health care that is achieved because hundreds of thousands of people in our state and in our community get their health care through an Obamacare policy. And because of Democrats implementing, when President Biden was in office, the enhanced tax credits, it means that healthcare costs have been kept under control, and there are millions of Floridians who now can afford that healthcare coverage that would become too expensive and lead to less people being covered. And I'll just give you an example. If Republicans, for example, don't act now, then and they don't extend the tax credits, meaning they let them, December 31st rolls around and they let them expire. For example, I have 203,000 people in my district alone who benefit from lower healthcare costs in the Obamacare policies in the marketplace thanks to those enhanced tax credits. If those expire, those people will lose that affordable coverage. In my district alone, a 60-year-old working couple, for example, who earns about $82,000 a year would see their premiums rise by $18,000 annually. That's a 259% increase. This is completely unnecessary. All we have to do is sit down and negotiate this end-of-year spending plan so that we can not end those tax credits, that we can extend their life and ensure that people will have their healthcare coverage be able to be affordable. That's literally life and death for so many people. People die when they are not able to afford their healthcare coverage and they can't afford to go to the doctor. They literally die because they aren't covered. And I want to be clear that we're talking about Americans, American citizens, people who are legally able to work here in the United States. We're not talking about undocumented immigrants. So, all of this smokescreen that Republicans have been putting up, that's all baloney, because the people who get these enhanced tax credits are Americans. Holly, do you want to elaborate a little bit?
Sure, really quick. So the enhancements, it's kind of a mouthful to me, right? So the enhancements are just a boost, right? That in 2021, in response to COVID, that Congress and the Biden administration determined this is the time to also make it much more affordable So it is a portion, it is enhancement to the tax credit. The entire tax credit wouldn't go away, but a big chunk of it would.
Right.
And as you know, if you're very low income, if you're making $18,000 a year in terms of federal poverty level, $100 a month is actually pushing you over the edge, right? So it's not for nothing. And then also over 400% of poverty, that is that 80,000 around for that couple who are 60 years old. So right around there, over 400%, those folks no longer would receive the tax credit. So it is a big cut for, think like working class folks who honestly can't afford like extra $100 cost or $150. They're going to drop coverage, according to KFF and the CBO, right? Like they're projecting 1.9 million people in Florida are going to lose coverage.
Can we ban acronyms? Explain.
Yes.
Just say what KFF and CBO is.
Thank you. So KFF, Kaiser Family Foundation, is like the largest notable healthcare research organization nationally, and they're very dependent and dependable. And then also the Congressional Budget Office, who all through this created estimates and are very credible. And so in partnership, using each other's numbers, basically, they projected state by state estimates for coverage loss. Granted, over the last 6 months, in terms of all of these policies, HR 1 and the HR 1 being the big bad bill, and then also if these enhancements are not extended, those things combined, Florida, we would actually be impacted, and we would be the second biggest state impacted, right? We would be the second most people drop off of care and the second most spike in our uninsured rate. So yeah, Floridians and South Floridians especially, everyone should be really concerned about this.
I also want to add that in Florida, because Republicans have never expanded Medicaid access, we have almost 1 million people who are stuck in between qualifying for Medicaid, which they don't, and qualifying for subsidies, which they don't. So, I mean, this would be on top of that. We have nearly 1 million people who should be able to afford health care, but Republicans in our state have denied them that opportunity.
Thank you, guys. I've got another question here. This one is from Linda, and she wants to know, and I think this is probably on a lot of folks' minds, she wants to know what happens with pre-existing conditions and people who use Obamacare insurance. Will they be affected if the health care rates are not protected? Congresswoman, you want to take first stab at that one?
Sure. So, yes, they will be affected, but not as directly as that question implies. Taking away the Affordable Care Act tax credits doesn't directly impact pre-existing condition protections because they are embedded in the Affordable Care Act federal law. But, and this is how it can indirectly affect folks, is these are vital protections that if coverage becomes unaffordable and if more people lose Affordable Care Act coverage, then that could force them into the more broken part of the system of high-risk insurance pools or ultimately into medical debt. I mean, people who don't have health insurance at all because they can't afford, they would no longer be able to afford it. They're forced into a system where they have to use the emergency room again as their primary access point for healthcare. And then you have these high-risk insurance pools which do limit the length of time, for example, that you can get access to care, the length of time before you can get access to care for a pre-existing condition. And obviously, the critical thing, and I can tell you this as a breast cancer survivor, because I found my lump myself very early on. My cancer was diagnosed at such an early stage that, I am here today to talk about it. Had I had to wait, or back in those days, because the Affordable Care Act wasn't law when I had breast cancer, because it was 2008, you could be dropped or denied coverage for pre-existing conditions. Under the high-risk plans, you could be forced to wait before you can go get that checked out. And we know that when an illness or disease is diagnosed at a later stage, your complexities are more significant and your life is more at risk. So it's totally unacceptable, and we want to make sure that that risk is never realized. And I think, Vaishu, I think you might have a few things to add with that as well.
Yes, so as the Congresswoman said, people with pre-existing conditions won't be affected quite as directly as some other proposals that have been floated by Republicans would have affected them in the past. However, this is really an indirect way of making premiums so unaffordable that people also might be forced to choose cheaper plans that offer lower quality coverage, plans that have higher deductibles, and mean that folks with cancer and other conditions are going to have to pay more out of pocket. So that's really going to have an effect. And I know the American Cancer Society has done great polling, and that polling shows that without these tax credit, about 50% of cancer patients and survivors are worried about their ability to afford health care. And that's a very serious thing. I think it really illustrates what's at risk here for folks with pre-existing conditions. In addition to that, if you were someone who's on Medicare and you are struggling with cancer, the big giveaway that Republicans have given Big Pharma in this bill means that the huge win that Democrats got in the Inflation Reduction Act that allowed high-cost drugs to be negotiated down, the prices to be negotiated down for the first time, finally giving seniors the relief they need, they won't see that. For a couple of blockbuster drugs like Keytruda and Opdivo, that the negotiation of those drugs would be delayed and potentially off the table thanks to Republicans. So this is going to really affect folks with pre-existing conditions a lot.
Thanks, Vaishu.
Thanks, guys. I've got a question here from Jeannie, and she asks, can Medicare Advantage plans for senior retirees be protected? And why is Trump going after Medicare? And maybe, Vaishu, if you want to take a quick first hit at this one.
Yeah, so the big ugly bill basically was so fiscally irresponsible. Ironic, I find it, because Republicans like to talk a lot about fiscal responsibility, that it triggered $500 billion in automatic Medicare cuts that are going to be levied over the next 10 years. So that might be seniors seeing reductions in services, providers being paid less for those services. So certain providers might refuse to take Medicare. And I know that some providers are already refusing to take MA plans. And in addition to that, if you're a low-income senior, say you're making about less than $3,000 a month, then it's going to be harder for you to qualify for the Medicare Savings Program, which is when Medicaid comes in and helps you afford your Medicare premiums and helps you with your out-of-pocket costs. So lots of low-income seniors are going to be affected by this bill. You have those automatic cuts to Medicare that have been triggered. And then on top of that, again, for seniors who rely on these high-cost medications, it's going to prevent them from getting the relief that they need.
Great, thanks, guys. We're going to go to a question here that's a bit more shutdown focused.
And I want to
Please jump in, yeah.
Add something on to Vaishu's answer, and that is this. Medicare and Social Security, but in this case we're focused on Medicare, are the third rail of Florida politics. We have the highest percentage of seniors of any state in the country. Imagine, wrap your mind around how many people would be affected if Medicare Advantage plans are knocked out or severely impacted. If you have a $500 billion cut to Medicare, unnecessarily triggered because Republicans blew such a huge hole in the deficit with their big ugly law, that budget requirement automatically triggered. We always try to make sure we don't go near that possibility, because you don't want to put seniors in a situation where we are forcing Medicare cuts on them. So the fact that they did this without regard for the impact on seniors, because they so badly wanted to take care of the wealthiest, most fortunate Americans with massive tax breaks, and this is a party that usually cares supposedly about not deepening the deficit. The hypocrisy and the disregard for seniors' well-being was astonishing.
Yeah, thanks for adding that, Congresswoman. I have a question here next that's really just focusing on the shutdown. And if maybe I can throw this one to you, Congresswoman.
Okay.
In a government shutdown, does that mean Social Security checks won't go out? You know that we always get questions like that. That's
Yeah.
on everybody's mind. But could you go ahead and share what your take is on that?
Sure. During a shutdown, recipients, Social Security beneficiaries still continue to receive their Social Security and SSI security income checks, but the Social Security Administration will have much more limited services like issuing Social Security cards or conducting meetings for new applicants, customer service wait times, which because Trump has already severely cut back by firing employees at the Social Security Administration, and particularly in the call centers. That means that wait times in call centers will dramatically increase. I'll tell you, as it is right now, we tested how long it takes the average person to get a call answered at the Social Security office call center. My staffer sat on the phone for just over 3 hours. In fact, we posted the screenshot of how long we were holding. That will likely get longer because Republicans are going to potentially force us into an unnecessary shutdown. If you have any issues with your Social Security benefits during a shutdown, please reach out to my office. That it will remain open. It will be fully staffed. But look, DOGE, Trump, and Musk really harmed our Social Security system and made services even more difficult to get. And a government shutdown forced by Republicans unnecessarily will make that worse.
Thanks so much. And Holly, I think I want to just steer this one down to you. It's basically this: how will the increase in healthcare impact small business owners, especially in Florida? And I just want to, if I can, share with you a message that Patricia sent in to us tonight. And this is what Patricia just forwarded to us. I'm a small business owner. I pay 100% of my employees' health and dental insurance. I spend $80,000 per year for their insurance. I will not be able to offer insurance to my employees if the ACA tax credit is cut. So can you just maybe comment on what you think small business might feel if these cuts go through?
Yeah, Patricia's not alone in Florida. Florida has more people who use the ACA who are also happen to be small business owners or are self-employed. We actually have just under 1 million people in Florida. So 1 in 23 people in Florida are just like Patricia. That'd be more percentage in terms of South Florida, again, which is a very large ACA marketplace area. And what does that mean? That means that small businesses and individuals who receive health care and or offer health care in partnership with the ACA and leveraging those tax credits as a way to offer employment, as a way to basically have a small business at all and retain workers, or have the ability to do so yourself and not having to be not having to find a job that has a specific opportunity for healthcare. It really adds to a lot of mobility in our economy. In Florida, given that 1 in 5 people are on Obamacare and that this is going to be a huge impact to that, making it much more expensive, honestly, especially for seniors right before retirement, as we said, like those folks, the cost of that, and honestly, that's a lot of our population, as the Congresswoman was saying, right, that this is a huge impact on Florida. Honestly, I have been dreading this moment for a year at least. I knew this was coming, that Floridians, we don't really understand how much we depend in our economy, which includes small businesses, of course, especially in South Florida, which is just a vibrant, various part of our culture and engaged community that actually leverages the ACA to do that. And so you're going to see a lot of small businesses maybe even close shop or not be able to do that and have to pivot to and is going to be a huge damper on our economy for that reason too, right? In addition to, honestly, the healthcare jobs that are projected to be cut, given this large amounts of people losing care in Florida. So we forget that this is also sort of a jobs program, to be honest, right? That this is a huge opportunity for people to have their dreams come true, to be, we all know someone on Obamacare in Florida. Like, you could reach out and touch someone on Obamacare in Florida, right? That It's your friend who's a consultant who created her own consultancy, or your friend who's creating her own small business who supported, this is her dream, or maybe Patricia's dream. And so not only about people's health, but like it's their dreams. And honestly, Florida has more people, more small business people than anywhere else in the nation that are leveraging the ACA, just under 1 million people.
It's just critical. We should not be walking to the edge of this cliff. Republicans are walking us to the edge of this cliff. We're in Washington, they are not. We are really insisting for them to come to the table. Let's hammer this out. In fact, in most cases across the country, we have Republicans who have their own constituents in districts who are going to be dramatically impacted by the end of these enhanced ACA tax credits. I mean, huge in Florida, but that is a lot of Republicans across the country who I hope also don't want their constituents to not be able to afford their health care. I know firsthand, if you don't have your health, you don't have anything, and everything in your life fades into the background. So this is a moral issue. I mean, making sure people can take care of their own health is a moral issue.
Congresswoman, I know you had a question that you wanted to ask each of your guests. Do you want to run that by them?
Please. Holly and Vaishu, you both have been really intimately involved in discussions like this. You can tell through the detailed answers you've been giving about just healthcare in general and the ACA tax credits. What's the largest misconception that you're hearing out there that needs to be addressed in this debate? And Vaishu, we'll let you go first.
I think the largest misconception is the characterization of who's going to be affected by these cuts. Republicans like to throw around the word able-bodied, and the vast majority of people on Medicaid are working. The vast majority of people on enhanced premium tax credits, on getting their insurance through the ACA marketplace, are working. We just heard from a small business owner whose employees rely on this. These are working Americans who are going to lose their health care. We might as well call this tax credit the working families healthcare tax credit, because that's what it is. So Republicans like to spread lies about, oh, this is to go after undocumented immigrants or people who don't work. But the reality is, like, this is going to cut healthcare away from 15 million people. And the vast majority of those people are your neighbors, their working families, their small business owners, their children. Like 40% of children in Florida rely on Medicaid. 60% of seniors in nursing homes in Florida rely on Medicaid. So these are the people who are really going to be hurt by this bill, not to even mention folks with disabilities, veterans, and other people. So I just hope that people know it's not who Republicans want you to think, and also that even if you're not on Medicaid or the ACA, this is going to affect you too, because hospitals are going to be more at risk of closure. Some of the more finicky ACA policies mean that your premiums, your out-of-pocket costs will also go up as well. So because so many people will be uninsured, that means at the ER you're going to be waiting longer. That means that when hospitals can't cover those costs for those patients, those will then get passed on to you. So if you're sitting at home thinking that because you're not on Medicaid or not on the ACA, also this won't affect you, sadly, that couldn't be further from the truth.
Holly?
Right, absolutely. And, coming from Florida and sitting in Florida, I think from my perspective, one of the biggest misconceptions has been, even with like national health advocacy spaces, or even locally, some people who are really well-meaning and wanting to get involved and support and to follow along with the policy. I hear this a lot, which is that, well, the big bad bill didn't really come after Florida. It went after expansion states. So Florida is a non-expansion state, as in we haven't expanded Medicaid yet. And that could not be further than the truth in terms of, again, who is directly in the crosshairs of what this impact is going to be from both the big bad bill and then also these enhancements that are on the line right now, right? And so the big picture is that Florida's healthcare is dramatically going to be impacted, and it's actually, as I said before, like the second most spike in uninsured rate, and it has the second most people who are projected to drop off, like in terms of just sheer number. We're the third largest state, but like actually have a huge amount of people who are going to be impacted. And that's honestly because we haven't expanded Medicaid in Florida. I also serve as co-chair of the ballot initiative in Florida for Medicaid expansion. We're still working on that for all the Floridians out there. But that's because we already have so little in terms of healthcare and funding and coverage in Florida, that Obamacare and the enhanced credits were really this huge investment in coverage for Florida, right? It grew more than doubled, okay, since 2020. It has blossomed and supported Florida, is basically holding up our healthcare system in Florida. Many people don't realize this. So any cut to Obamacare is a cut to Florida, like bar none. And that is a huge misconception, is that I hear over and over again from reporters, from lots of people, not our Florida folks, but knowing that, oh, well, Florida's safe, you guys aren't being cut. It couldn't be further from the truth. And everyone needs to know that and get involved.
Absolutely. Thank you.
Great. Those are great answers, guys. And I think, unfortunately, along that same myth or misperception, this question comes to us. And we saw a lot of this in the chat. So I really, Congressman, if you want to go first, but maybe if you all have like a swing at this one. I think that there is a concern, and this was Mike who sent this question in. Are there illegal immigrants taking advantage of our healthcare system? And I think that that's the way that Republicans are sort of packaging as an excuse for what they're doing. Congresswoman, you want to take that question?
Sure. This was the biggest outrage during the entire debate over the big ugly law and the fact that we have this looming healthcare cliff that Republicans are getting ready to shove so many people off of at the end of the year, because they said throughout the debate, straight up said that this was all about fighting waste, fraud, and abuse, because they needed to eliminate the undocumented immigrants who were supposedly getting these tax credits. Undocumented immigrants are already prohibited under federal law from getting these ACA tax credits, and they don't get them. They kicked 15 million people off of their health care. I mean, there were not any, or almost any. Look, there's could you find someone who accidentally got on? I bet you could, because that kind of stuff around the margin happens. But 15 million people were kicked off their health care by Republicans under this big ugly law, and undocumented immigrants already prohibited from getting those tax credits. We're fighting to extend these tax credits so that coverage stays affordable for working families, for those small businesses and working families that Holly and Vaishu talked about. We're not trying to expand them or make anyone eligible who isn't currently eligible, who can't get them already. That is just baloney, a smokescreen that Republicans threw in front of the cruel, heartless decision that they were making that ends affordable health care for 15 million people. Federal law, again, prohibits undocumented immigrants from getting comprehensive Medicaid coverage also. So they can't get the ACA tax credits, and undocumented immigrants can't get Medicaid coverage. They can't get comprehensive Medicaid coverage. We're not proposing to change that law. Democrats aren't trying to repeal that law. And, of course, you have the biggest victims of Trump's, anti-illegal policies. Those are lawful immigrants and citizens. I mean, those are the people that get hit the hardest. So the Republican big ugly law included provisions that took health care away and food stamps away. So children's nutrition from U.S. citizen children. Let me say that again. It took health care away and food stamps, nutrition assistance away from U.S. citizens' children because their parents were undocumented. If their parents were undocumented. Now, why do you lose your benefits or your rights as a citizen just because your parents might be here and are undocumented? U.S. citizens have the same rights no matter who their parents are. That's federal law, and that's what's in our Constitution. So that's an outrage, and so just need to make sure it needs to, anytime you see someone post something stupid on social media or hear someone on TV in some news interview that all the Republicans did was, make sure that undocumented immigrants couldn't get this health care in Medicaid or through the tax credits, that's bull, because they couldn't and don't already. And Holly,
Great, thank you for that
answer. If you have anything else to add, you can feel free.
Yeah, Holly or Vaishu, anything you guys want to add to that?
Yeah, I was just going to reiterate, no undocumented immigrant can qualify for Medicare, Medicaid, or the ACA. So this is not an issue. They're trying to use this as a giant scapegoat for taking away 15 million Americans' health care. And the vast majority of the Americans who are going to have their health care impacted by this is actually Trump voters. And it makes me sad because they're being lied to. You can actually look it up from that resource that Holly mentioned. KFF did an article about this, about how Trump voters really make up most of the growth that's happened in the ACA enrollment in the past couple of years. So it's really sad that the folks who are sitting at home getting angry at times about this, something that's not a truth, might have their health care taken away from them.
Thanks, Vaishu.
Thanks, guys. We have another question, and this one came in on the chat this evening from somebody who's watching. They wanted to ask, what will a shutdown do to healthcare for veterans? And Congresswoman, given your role in Congress and the subcommittee you sit on, maybe you could take first crack at that.
Sure. I'm the ranking member, meaning I'm the lead Democrat of the Appropriations Subcommittee on Military Construction and Veterans Affairs. So we cover the entire VA budget. So Paul, during most shutdowns, VA medical centers and clinics are open as usual. VA benefits will continue, like pension and tuition and housing. The VA staff, though, will be working without pay. So know if you are going to a VA facility, thank them extra for their service, because they won't be working for income until after the shutdown is over. The mental health crisis line, for example, that stays open 988+1. I'm concerned, though, about the long-term impact that a shutdown will have from Republican policies on veterans' quality of life. If it drags on, you have Trump, who ordered all agencies, including the VA, to prepare to permanently fire, not furlough, but permanently fire hundreds of thousands of federal workers. If you add that to the big cuts that already were proposed by Republicans to VA supportive housing, to career services, and you'll start to see declining services, longer wait times across the board. If he uses vengeance during this shutdown and fires people permanently because he's mad that Democrats stood our ground and wanted to make sure that we made healthcare more affordable and stayed affordable, and that we protected people's healthcare, that's vindictiveness that would be the height of cruelty. So I'm committed to restoring these programs and fulfilling our promises to our veterans. I work hard on that every single day, but for the most part, under a shutdown, the everyday services will be continuing.
Great, thank you. We're starting to run low on time here. I'm going to try to get one more question that was submitted to us.
Okay.
And this is from Marissa Bell, and she's in Dania Beach. She wanted to know, how will a government shutdown impact federal workers? And she was especially curious about those who are going to retire soon. Congresswoman, you want to go first on that one?
Sure. So obviously a government shutdown is really damaging and harmful to the personal lives of federal workers. They're painful to the American people, which is why it's so outrageous that Republicans are willing to shut the government down while taking health care away from millions of Americans and making even more health care coverage skyrocket in terms of their cost for even more people. You'll have civil servants, federal workers, who will either be furloughed or forced to continue to do their job without pay. It depends on whether they're designated as essential workers by their supervisor. During a shutdown, usually essential programs continue, like Social Security, like the VA services that we just went over, military operations, obviously. But like I said, Trump's budget director ordered every federal agency to draw up plans to permanently fire, not furlough, meaning they get their job back after the shutdown's over, hundreds of thousands of federal workers. 300,000 civil servants were already doged by the so-called Department of Government Efficiency, or forced retired this year. That will shred the institutional capacity of our agencies and make it impossible to restart crucial programs, even if the shutdown ends. I hope the president doesn't go through with this threat, and sits down at the table with our leadership in the House and Senate, Republican and Democrat. We just need to come together and do what businesses do over contract negotiations, labor unions, the same thing. We need to sit down and negotiate. There are two sides to this debate. There are two sides to this budget difference of opinion, and we need to come together and make some compromises. Democrats are here in Washington, seated at the table, ready to go, and Republicans are not here. So I hope the Speaker of the House, Mike Johnson, calls the House back into session, or at least tells his Republicans to come back, so we're ready to vote as soon as we can negotiate a final outcome here. That final outcome, from our perspective, my perspective, is that we have to make sure that we lower people's costs, that we eliminate the cuts, and that we save Americans' health care. That's the bottom line. It is so achievable and so unreasonable that we don't have Republicans working with us to achieve that.
Great. Thank you, Congresswoman. And I think that we're about to run out of time. An hour sure goes by quick. If I could, though, I would like to have both Vaishu and Holly sort of give us like maybe what their last takeaway is, or what you'd like people to remember as we hear more about this debate. And then, Congresswoman, maybe you could say one last thing to close this out. But Holly, why don't you start us off and just take a minute and make the final point that you think people should take home tonight.
Sure. ACA, the Affordable Care Act, Marketplace, the tax credits, it should not be partisan, honestly, because it's not in Florida. And as you had mentioned, Vaishu, about looking at who's benefiting. In Florida, it is everyone's. It's across party, across race, across, even income, that you have just working class, middle class, all these people in Florida who benefit. And that South Florida is about to be impacted more than anywhere else in the nation with this policy that we're talking about right now that's on the line. And so honestly, really engaging and understanding that impact, and that this should not be partisan. Our healthcare shouldn't be. We should be able to come across party and say, oh my gosh, especially Floridians, it's going to really hurt Florida and South Florida the most. And we need to wake up and engage and talk to our partners, our community members, our members of Congress, outside of our representative with us today. But it's so important, and just South Florida will be impacted the most. And that's what I wanted to share.
Thanks, Holly. Vaishu?
Yes, thank you so much. I think, again, what I wanted to reiterate is this bill is going to affect everyone, regardless of where you get your insurance. And it's going to affect seniors, it's going to affect children, it's going to affect people with disabilities. It's really going to affect you no matter what walk of life you come from. No one's safe from this bill. And in addition, when it comes to the premium tax credits, Republicans want you to think that, oh, this is something we can get to at the end of the year. It's not. Time is of the essence. The Congressional Budget Office, which is like the nonpartisan kind of referee of Congress, found that 1.6 million people will lose their coverage if Republicans continue to put this off till December. And also premiums will go up even more. You're going to see a 4% increase on top of what we're already seeing in that 90% that we expect in premiums, simply because of that continued uncertainty in the marketplace from Republicans not doing the right thing. So I think those are the big takeaways from tonight. Time is of the essence, and everyone's going to be affected.
Thanks so much, Vaishu. I really want to thank everybody for joining me tonight, and I wish I could say I was surprised by all the angst that we see and heard in these questions, but like I said, I know from personal experience, and we just had my second Cancer Survivorship Summit, and there are so many people who, when they struggle with illness, when they know that a potential healthcare challenge is right around the corner, that if they don't have access to quality, affordable healthcare, then they know that they're going to be in a world of hurt. And in South Florida, like Holly and Vaishu have said, particularly in South Florida, if you nick the Affordable Care Act, it's like a gash in South Florida. It's a gusher. And we know that there are going to be people who are devastated by the skyrocketing costs, by the loss of Medicaid. And one of the things that I think it's important to underscore as we close here is that I've had hospital CEOs share with me, and community clinics talk about how they don't know how they're going to be able to keep all their programs open. Just here in South Florida, there are rural hospitals that are going to close, and some are starting to already. But there are programs like at Jackson South, where my husband was treated when he had a mild heart attack a number of years ago. They closed down their maternity ward because they can't afford to keep it open anymore. And they did that in anticipation of the loss of a patient base because of these Affordable Care Act tax credits and the loss of Medicaid from the big ugly law. It doesn't have to be this way. We can sit down and we can figure this out. Democrats are insisting that we're not going to just accept a partisan Republican spending bill and call it a day. We're going to push to make sure that we can save people's health care, that we can eliminate the cuts, and that we can ensure that we lower people's health care costs and keep them affordable. That's what I'm going to continue to fight while I'm up here. And by the way, Fins up, the Dolphins are up 10-0. Pretty good for Monday night football appearance, and hopefully it'll stay that way. And thanks so much to everybody, to my guests, Holly and Vaishu. Thanks to Dave, our MC, and look forward to talking with you all when I get home. Thanks so much. Bye, everyone.